GST reforms, which is a landmark achievement, including for the medical sector, we request you to consider zero-rated GST for healthcare facilities, as due to their exemption from GST, we are unable to claim the input tax credit on the services that are availed by patients, leading to higher costs of care. Sir, we once again assure you that the healthcare sector is committed to supporting the government in achieving its vision of universal healthcare for all Indians. Through continued investments in innovation, infrastructure, and human resources, the industry stands ready to partner with policymakers in expanding access, improving quality, and building a globally competitive health system. Today, as we surge ahead, I urge every delegate, thought leader, and partner to engage in further deliberations with the highest spirit of collaborative action. The defining moments of the future are not inherited, will never be inherited. They have to be co-created. Let us ensure that Care at 25 sets the unshakable foundation for a healthy, resilient, and prosperous India. Thank you all very much.
Thank you so much, sir, for setting the stage with your very insightful words and offering such a warm welcome to all the attendees. I now welcome Mr. Harshvardhan Agarwal, President FICCI, to share his remarks on the significance of this conference as well as the healthcare sector for India.
Honorable Minister, Sri J.P. Nadda ji, Professor V.K. Paul, Honorable Member, Health Niti Aayog, Honorable dignitaries on the dais and off the dais, a very good morning to all of you. On behalf of FICCI, I warmly welcome all of you on the 19th edition of FICCI Heal 2025. We are deeply honored to have visionaries and leaders who continue to shape India's healthcare transformation with us today. This year's theme, Care at 25, Defining Moments in Healthcare, is more than a title. It is a vital call to action. It serves two critical purposes. First, as a commemorative marker for the 25 years of transformative growth since the turn of the millennium. And second, and more crucially, as the launchpad for the next chapter of our health journey towards FICCI Bharat by 2047. The past 25 years have witnessed remarkable milestones. The National Health Mission, Ayushman Bharat, and over 800 million HABA IDs have created the world's largest publicly funded health coverage system. The recent GST reforms, reducing rates on medicines and medical devices from 12 to 18% to just 5%, have made healthcare significantly more affordable for millions. India now stands as the world's largest vaccine supplier and a leading manufacturer of generic medicines. Our healthcare professionals serve pivotal roles globally, while our medtech sector emerges as a dynamic hub for innovation and affordable solutions. Public health expenditure has also risen from 1.28% of GDP in financial year 19 to around 2% in 25, with the industry projected to reach around $640 billion by 2025. The rising burden of non-communicable diseases, our aging population, and persistent rural-urban disparities demand urgent attention. Reducing out-of-pocket expenditures, currently among the highest globally, remains critical. The next 25 years must harmonize accessibility, quality, innovation, and sustainability, ensuring no one is left behind. We must also shift from sick care to health care, embracing preventive health as our primary strategy. The Ayushman Arogya Mandirs and the wellness centers represent this philosophy, but we need deeper penetration of preventive screenings, lifestyle intervention programs, and health literacy campaigns. As the saying goes, prevention is better than cure. And in India's context, it's also more affordable and sustainable. Every rupee invested in prevention saves 10 in treatment cost while dramatically improving quality of life. As our Honorable Prime Minister Shri Narendra Modi ji said, a healthy India is the foundation of a developed India. Healthcare is not an expense, it is an investment in human capital. The FICCI Health Service Committee has partnered with government for 2 decades, advancing standardization, medical education reforms, and shaping transformative programs like Ayushman Bharat and National Digital Health Ecosystem. I acknowledge our leadership who are guiding and shaping India's healthcare ecosystems and countless others who drive our healthcare initiatives forward. As we celebrate Care at 25, let us recommit to building an inclusive, resilient health system. Together, government, industry, and caregivers, we will shape the next era with equity, excellence, and compassion at its core. The recent GST relief for health insurance premium exemplifies responsive governance. The digital health market's projected growth to US 53 billion by 2030 signals immense potential. These are not just statistics, they represent millions of lives touched, families protected, and futures secured. May these deliberations inspire actionable solutions for a Swasth and Viksit Bharat. As we embark on this defining journey, remember, healthcare transformation is not the work of government or industry alone. It is our shared national mission. I wish FICCI Heal and all the participants a tremendous success, and once again, I welcome our Honorable Minister Shri JP Nadda ji today. Thank you so much. Namaste.
Thank you so much, sir, for sharing those achievements and the role played by FICCI and its members for this important sector. Ladies and gentlemen, we now are going to invite a global recognized public health expert and medical scientist. We are very deeply honored to have with us Professor Vinod K. Paul, member Niti Aayog, Government of India, to kindly guide us with his words.
Namaskar, good morning. Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, Shri Jagat Prakash Nadda ji, respected Shri Harshvardhan Agarwal ji, President FICCI, dignitaries on the dais, dignitaries in the hall, distinguished colleagues. It's an honor to be here. FICCI Heal is an iconic event which all stakeholders look forward to. I congratulate FICCI for the profound work that you are contributing toward India's progress and development. We are all united in our efforts, individual and collective, to achieve the highest aspiration of a Viksit Bharat at 2047. And all sectors, all stakeholders, all of us individually and as professionals have the onus on us and the motivation and commitment to work in that direction. And I think that's one resolution that we all share in this room. Viksit Bharat at 2047 on the one side is about a $30 trillion economy. That's one imperative. The second imperative in terms of our sector is to raise life expectancy from the current level of 71 years to 85 years or more, healthy life expectancy from 60 years to 75, because these are the benchmarks of the developed nations of the day, and that's what we all have to strive. And therefore I urge, just keep this ultimate imperative in mind: saving lives, prolonging lives, and ensuring healthy lives. Not just long life, but a healthy life. In that context, and in the presence of the Honorable Minister, sir, I wish to bring to your kind attention 2 points. First, we will surely need more hospital infrastructure. Our current hospital infrastructure